All right.
Well, hello, good morning.
Good morning. How are you?
I'm doing well. How are you?
I'm doing well, thanks.
Thank you for coming and meeting with me this morning. I'd like to start off this session with just getting a general idea of what brings you in today, it'll give me more information about you and give me an idea of what ways I can help you.
Sure.
All right,
Sure.
so I'm going to start with just some general questions like what brings you in today? What is the main problem that you are dealing with that brings you in?
I have been having all sorts of trouble with my girlfriend recently, and I just kind of feel like we're at an impasse, and I don't know what to do. And it's starting to make me feel kind of anxious and down, and I'm worried about whether I'm going to be able to fix this.
Okay. And I just want to say if you ever see me looking down, I'm taking notes on what you're sharing with me.
Okay.
And that way I can look back and refer to them at later counseling
Sure, that
sessions. Is
makes
that
sense.
okay?
Yeah, absolutely.
Okay, all right. Now, with the troubles with your girlfriend, what have you done up to this point to deal with those troubles?
Well, I've tried talking to her on many occasions, and sometimes I feel like that goes well, and many times I feel like it's just making things worse. Um, I've tried talking to some of my friends about it, but I don't know, I feel like they kind of take her side, and they're not really very supportive. So I guess I'm just not really sure what to do to handle it.
Okay. Now, coming into this counseling session today, what do you want us as a counseling service to be able to do to help you? What types of things are you looking forward? What are your goals of this counseling session with me?
Yeah, I guess I'm hoping maybe you can give me some ideas for dealing with the relationship, that, things that maybe that I haven't thought of. And I'm certainly hoping that if I can make things a little bit better in that relationship, then that will make things better for me. And I won't be having, the, I won't be feeling down or having trouble sleeping or things like that I've been going through.
Okay. And is there any information before we go deeper into this counseling session that you think is important for me to know?
Oh, I haven't had the best luck with women up to this point in my life. I've been married and divorced twice now. So, yeah, I don't have a great track record when it
Okay.
comes to relationships, but this is a relationship that I really want it to work.
Okay.
So that's my hope. I guess I'm not very good at it.
Okay. I appreciate you sharing that. Now, this next portion of this inventory, I want to learn a little bit more about your personality.
Okay.
So I want you to think of about 3 to 5 things that others would say about you, your friends, your family, your co-workers. What would people say about you who know you?
Other people would say about me. Well, I guess they would say that I am um, smart in some things, but kind of dense in others. I mean, I don't feel that way as much, but I think other people would say that about me.
Hmm.
Um, I think they would say I'm sincere, that I'm trying here. Um, One thing I've heard my whole life from people around me is that I'm kind of nerdy, sort of a geek, which I guess is true. I'm a
Okay.
scientist, and so that's kind of my life. That's who I am. But I think they would also say that I'm trustworthy and dependable,
Okay.
a good guy.
Good guy. Okay, I appreciate that. All right. So the next section of this inventory is going to focus a little bit more on health and your health history,
Okay.
and also current health situations you may be dealing with in the moment. So, as of now, how would you rate your physical health out of very good, good, average, declining? How would you rate your current health?
Oh, I would say it's very good.
Okay.
Yeah.
All right. And have you had any significant weight changes recently in terms of weight loss? Have you gained any significant weight?
Well, I guess it sort of depends on what you mean by significant, but I have lost weight during this time because I think I'm just not eating as much
Okay.
because I'm feeling so anxious. Yeah.
And I'll try to clarify what I mean by significant weight. Anything over 5 pounds? Have you
Oh
lost or
yeah.
gained over five
Yeah.
pounds?
I feel like I've lost probably 7 or 8 pounds.
Okay.
Yeah, recently.
Okay. Now, can you tell me a little bit about any important present or past illnesses or injuries that you've had? Anything that needs to be noted, outside of anything simple like a paper cut or simple things like
Yeah.
that.
Yeah. Not really any illnesses. I did have a rugby injury maybe a year ago, and about 3 years ago, I broke my nose.
Okay.
So those have both, yeah, I've had both of those, but I think they're healed by now.
Okay. And what was the nature of the rugby injury? Was that the broken nose or was that a separate?
No, that was a more like my lower leg and foot
Okay.
got trampled, and the nose injury was actually from a flying puck at a hockey game.
Okay.
Came right at my face and busted my nose.
Oh, wow. Well, okay. Now, have you ever used any drugs? Have you ever used drugs for anything other than medical purposes? Anything recreational?
Oh, I guess I've probably smoked pot a few times in my life, in college, in
Okay.
grad school. Um, and I drink alcohol from time to time, not in excess usually, but um, yeah, just those two things. Nothing harder.
Okay. And are you presently taking any medications for physical reasons?
Medications for physical reasons. No.
Okay. Now, what positive things impact your physical health? Are there any things that you do that make you feel good physically?
Oh, well, normally I stay pretty active physically, and that makes me feel better, and it makes me sleep well usually. Um, and I take my vitamins, um, and I would say, I don't know if this is really about physical health, but I do have a really tight knit group of friends,
Okay.
and that makes me feel good.
All right. Well, I appreciate you sharing that with me.
Yeah.
And then again, if it helps you feel good physically, I'm going to list it here. So yeah, I do appreciate you thinking of that and sharing it. Now I want to move beyond physical health and look into your emotional health.
Okay.
Have you ever had a severe emotional upset? Has there been anything where you have reacted in a severe manner emotionally?
Well, yeah. When my first marriage broke up, that was a time when I felt really down and depressed and just kind of, uh, I don't know, disoriented. Like I didn't know what to do. I didn't know what my life was going to be like after that.
Mm-hmm.
Um, right now, certainly, I'm feeling a lot of anxiety and stress about my current situation. So those are at least two times in my past and also right now when I um, have felt pretty emotionally upset.
Okay. All right. Now, have you ever received any type of counseling for anything in the past?
I have, yeah.
Yeah. And where did you receive counseling at? And when did this counseling occur?
I did this when my first marriage broke up.
Okay.
I saw a therapist for I went either 3 or 4 times. I don't remember.
Okay.
And it was just somebody that was recommended to me by someone I work with.
Okay. And this was after the first marriage ended?
That's right.
Okay. All right. And what was the outcome of previous counseling experiences? How did that experience turn out for you?
Um, I didn't feel like it was a huge benefit. Um, I got to talk about my feelings, and the counselor told me that what I was feeling was very normal. And I suppose that made me feel a little bit better, but I don't feel like it was a huge help
Okay.
before.
Okay. Now, how many supportive people do you currently have in your life? Um,
Supportive people?
Supportive people, yes.
Oh, well, there's my group of friends. So that's 5 other people, and my parents, 7. I've got a couple good friends at work, so I'd say 9 or 10
Okay,
in total.
excellent. All right. And that's very positive to when you have those people around you to be able to lean on to get through difficult times.
I think so.
Now, have you ever attended a support group that addresses the topics that we are discussing today? Difficulties with relationships
Oh,
and
no,
maintaining.
I
Okay.
haven't. No.
Okay. All right. And are you presently taking any medication for emotional reasons?
Remote, like a depression medication or something?
Yes, or an
No,
anxiety, anything like
no,
that.
not right now.
Right. And have you ever been hospitalized for emotional or psychological concerns?
Mm-mm.
Okay. And again, thank you for sharing that. All right, so I'm going to go over a list of different experiences, different medical concerns, psychological, emotional things that will give me an idea of, again, your history with health.
Okay.
And these are going to be yes or no questions, and you can just tell me if you've experienced this or not.
Okay.
All right, so migraines. Have you experienced migraines?
Migraine headaches? No.
Okay. What about stomach problems?
Just when I get sick, like a flu, but nothing beyond that.
Okay. What about sleep difficulties?
Yeah, for sure. Right now.
Okay. All right. And if you had to ballpark about how long you sleep a night in terms of hours, what would you say?
Right now or normally?
Normally on average,
On average, I would say 7 hours.
7 hours, and with your current situation, the difficulties you're experiencing, what
Oh,
would you say?
feels more like 4.5.
Okay.
Yeah, right now.
All right. Now, what about sexual difficulties? Do you have any of those difficulties? And I hate to, ask such an invasive question.
Yeah, I guess we have to talk about it. Once in a while, yeah, I
Okay.
feel like I have some performance anxiety, maybe performance issues.
Okay. Now, would that be just a current issue, or is there a history of it as well?
Uh, I guess if I'm being honest, I've always dealt with it at least a little bit.
Okay.
I mean, since I've been an adult.
Okay. All right. Well, it looks like we've reached our time for today's session.
Okay.
So again, I want to thank you for sharing the information that you've shared with me today. I'm going to use this in our next session to again continue to get more information about you, which will help me better assist you with whatever you need from me.
Okay.
Do you have any questions about what we've talked about today?
Not right now.
All right. Well, I thank you for meeting with me, and I hope you have a wonderful rest of your day.
Thank you so much.
Thank you.